Good afternoon, everyone. We are convening the Committee on Consumer Protection and Commerce. It is Tuesday, March 24th, 2026, 2:03 p.m. in conference room 329. A nice fun agenda for you all. Vice Chair, go ahead.
Thank you. Just a quick reminder that we have a 2-minute time limit for testimony, and I have a little timer here that will flash in rainbow colors. When it goes off, I will just politely ask you to wrap up your comments in the interest of staying on track for our agenda. So first up on that agenda is SB 2433 SD1 relating to condominiums. Requires the Condominium Education Trust Fund to be used for educational resources for condominium unit owners in condo governance. Requires the Real Estate Commission to ensure the interests of condo unit owners are represented in certain activities funded by the Condominium Education Trust Fund, and to adopt rules protecting the rights of those owners for purposes of condominium governance. First up is the Hawaii Real Estate Commission in support. Thank you. We have Greg Misakian, individual in support.
Hello, Chair, Vice Chair, members of the committee. My name is Greg Misakian, and I'm here today because my building lost power today. So I was testifying earlier by Zoom for other hearings. And there's a relevance to that because as I walked down the staircase of my building, there were emergency lights in the stairwell that were out. There was still water on the landing from water that came into our building during the storm. And there were many issues. We have lots of issues in my building. The fire alarm panels haven't been working for quite some time since the storms happened. There are many issues in buildings throughout Hawaii and condominium associations when they're mismanaged or there's problems. And with that said, you know my background. You know I serve as president of Kakua Council. I'm the vice president of the Hawaii Alliance for Retired Americans. I'm a member of the Good Government Caucus. I'm a former Waikiki neighborhood board member. I'm a director on my condo association board. So I'm saying this with experience and knowledge. What this bill does is it's just providing some additional support so that our legislators recognize that myself as an owner and an advocate would like to sit at the table with the different committees and task forces and PIGs that are created, the Real Estate Commission PIGs or committees. And I've asked personally to Mr. Kleinhans over there to participate. I've yet to get an invitation. They want to be, the other owners and myself want to be able to sit at the table and be considered stakeholders. That was the word that the introducer of this bill had used previously. I don't know if it's been stricken completely, but stakeholders is a global term. We want to be recognized and we want to have voting power. So just like at the Real Estate Commission, there's a non-real estate certified, broker or agent that's on that commission. So with that said, just to, I know my time is limited. We just want to be able to have a seat at the table and help make the decisions because there's very bad things happening in condominium associations, and mine is one of the worst. So I don't have time to share that. If this goes further, I'll be sharing a lot more at the judiciary hearing. I believe this goes to one more hearing to judiciary, but I might be wrong. I might be thinking of CPN. With that said, if you do have questions, I would appreciate the questions because the questions will be able to.
Spend 2 minutes.
Thank you. We'll be able to add some story. Thank you.
Thank you.
Thank you. Anyone else in person or online who'd like to testify on this measure? Seeing none, members, any questions?
Real Estate Commission. So there's testimony from Phil Nerney and Richard Emery in our testimony today that says you guys can already do this?
Yes.
Do you need this bill in order to accomplish what this bill is trying to do? Or is this kind of repetitive?
Yeah, the bill's not necessary, but moving forward, since there's a bill that it'll be taken into consideration if the bill doesn't pass. That there was this legislation, and it was originally calling for to consider unit owners as stakeholders, which they're the primary beneficiaries of the CETF, so they are stakeholders.
So even if this bill doesn't pass, and I'm not saying we're gonna not pass it through this committee, but if this bill doesn't pass through the legislature, you can still, the real estate commission can still use the trust fund to educate individual unit owner.
Yes.
Is there a, were you planning on doing that anyway before this bill, or are you planning on doing it now?
Yes, there's stuff in progress. Yes.
Okay, is there a timeline on that?
Um,
When you expect the education efforts to go forward?
we gotta check because there is a solicitation out. Right now it's with the AGs for review. That project, say might be done by the end of June.
Oh.
At a realistic kind of
It's pretty, I mean, we just want a ballpark,
just for solicitation purposes to.
before the end of the year, is that fair?
Oh, yeah,
Thank you.
thank you.
Chair, can I ask a follow-up question?
Yeah, go ahead.
Thank you for the Real Estate Commission. So currently, even though condo owners are considered stakeholders, I think you conceded that. Does that mean they have a vote on the commission as a group? In the same way that we heard, there are different, slots that different people fill.
So I wanna make sure, that, the bill doesn't do that, right? I just wanna make sure we're asking questions about the bill.
Well, doesn't it kind of broadly indicate that wherever stakeholders, where condo owners are identified as stakeholders, that they have the same participation as other stakeholders? Isn't that?
Oh yeah, actually, I see your point. You can go ahead.
Hopefully I understand the question, but yeah, I mean, the condominium unit owners are the stakeholders of the CETF, so the funds will be used for education purposes. And there are committees and probably future committees that will be formed, comprised of unit owners.
But for instance, the Real Estate Commission itself, does it have slots for various stakeholders? And among those slots for stakeholders, are condo owners acknowledged as one of those slots? Where there's room for participation?
As for the commission composition,
Sure. Yes.
there are the 2 public seats. But it's not specifically a condominium owner seat.
Okay, but there are other, I guess, but you're saying that currently there is a discretion that it could be filled with somebody who is wearing a hat of a condo owner advocate.
Oh, yes. And then maybe if there was a part to, as for like committees that the commission creates, or for example, to improve education, just generally, then yes, it would be strange if owners wouldn't be on that, ad hoc committee.
Okay,
Because we do want that perspective.
okay, and they would have a vote, and I think that's the concern, is that this feeling that they're not being equitably included. For instance, whenever there's a property management company and there's realtors, that there also be condo owners, or at least somebody wearing the hat of a condo owner and looking at whatever it is, the rules, the laws, the recommendations of the task force from the perspective of a condo owner as a consumer. So
Sorry, you mentioned task force too, but the condo task force is attached to DCCA.
okay.
The real estate commission is attached to the PBL division of DCCA.
Right. But I think you're the only representative from that whole umbrella organization.
Yeah.
But
Here.
thank you. Okay, thank you.
Thanks.
Any other questions? Seeing none, moving on to SB 2047 SD2 HD1 relating to pharmacy benefit managers. Establishes certain requirements for pharmacy benefit managers that reimburse contracting pharmacies for drugs on a maximum allowable cost basis. Allows contracting pharmacies to reverse and rebuild claims if a maximum allowable cost is denied on appeal, and authorizes the insurance commissioner to assess fines for violations. First up is DCCA's Insurance Division offering comments.
Good afternoon, Chair, Vice Chair, members of the committee. Justin Tue from the Insurance Division. We stand on our written testimony to provide comments. Thank you.
Thank you. Hawaii Pharmacists Association and support.
Corey Sanders, Executive Director of the Hawaii Pharmacists Association, stating on our testimony and written support with an amendment, but also a proposal about potentially some other use of funds for PBM reform to set us up for success in the future.
Thank you. Kaiser Permanente with comments on Zoom.
Good afternoon, John Cameron, for Kaiser Permanente. Thank you, Chair, Vice Chair, Committee members for hearing this bill. Kaiser stands on his written testimony requesting a technical amendment. Thank you.
Thank you. Anyone else in person or online who'd like to testify on this measure? Seeing none, any questions?
I have one for Corey, actually. The DCCA Insurance Commission requested a lot in order to effectuate this bill. Do you have thoughts on whether that level of resource is needed?
It seems really high to me. Looking at MAC pricing alone is a really small subset of PBM reform. It gives me concern about some other issues that we would want to bring up in future sessions that I think would be more impactful. I asked some other state associations what their startup costs were. I'm getting under $1 million for some other bigger initiatives. But I know they spoke to this last hearing. They also considered startup costs with equipment, training from other states. It seems like a lot of FTEs and it seems like a lot of funds. But I'm happy to come back with any other data that I can get specifically for MAC pricing if needed.
Okay, I think this has one more committee to go. If you could maybe put that in the next testimony to the next committee about that.
Sure.
Thank you.
Any other questions? Seeing none, next up is SB 2425 SD2 HD1 relating to health insurance. Requires health insurers, mutual benefit societies, and health maintenance organizations to honor a patient's written assignment of benefits to a substance use disorder treatment provider. Prohibits anti-assignment clauses that restrict or invalidate a patient's right to assign benefits. Authorizes the insurance commissioner to adopt rules and take enforcement action, and deems violations to be unfair methods of competition and unfair or deceptive acts or practices in the business of insurance. First up is DCCA's Insurance Division with comments.
Hi, good afternoon again. Justin Tue with the Insurance Division. We stand on our written testimony providing comments.
Thank you. Thank you. The Ohana Treatment Center offering support on Zoom.
Aloha, Chair Matayoshi, Vice Chair Granadinetti, and members of the committee. My name is Elliot Smith. I'm the CEO of the Ohana Addiction Treatment Center in Kona on Hawaii Island and a person in long-term recovery. So I want to address two concerns directly. So first, HMSA says it's working to address this internally, and providers have been asking HMSA to change this practice for more than 5 years. And they've actively refused and gone out of their way to block direct provider payment. And that's not a disagreement, that's a standing policy. So now after the Senate passes this bill 25-0 and HLT passes it 7-1, HMSA says it will self-correct. But this committee should ask, what are they implementing? When does it start? Is it binding or voluntary? Because if it's voluntary, it can be reversed the moment the bill dies. So if HMSA truly intends to do this, then the bill simply puts their commitment into law. And that shouldn't be a problem. 5 years of asking produced nothing, one bill produced a promise. So second, the concern is that this creates a special class of providers, and it does not. A cancer patient does not relapse because they received a reimbursement check. But a person in early recovery from addiction receives a check for tens of thousands of dollars, and that money can kill them. We've lost a patient to exactly that in Hawaii, and this is not a special class of providers. It is the legislature recognizing a specific harm and matching the fix to the problem. The bill is narrow, OCA licensed residential and detox only. Every insurer fraud protection stays intact. 29 other states already have similar protections, and I respectfully urge the committee to pass SB 2425 HD1. Mahalo. And I'm available for questions if you have any.
Thank you. Next up is HMSA in opposition.
Good afternoon, Chair Matayoshi, Vice Chair Grant, and any members of the committee. Walden on behalf of HMSA. We stand on our written testimony in opposition to this measure, but as Mr. Smith had alluded, given the concerns of stakeholders as well as the legislature, our leadership has instructed our teams to secure a system and solution to allow for direct payments for non-par substance use disorder facilities effective 3/27, so this Friday. HMSA will now send direct payments to non-participating SUD treatment facilities in Hawaii, including the 4 facilities that are non-par on the Big Island, for all services provided to our commercial members. We agree that this solution best serves our members who are on SUD treatment plans in their long-term journey. We still have a lot of concerns about the assignment of benefit portion of this, but we do feel that the direct payments and supporting our members to not have access to the large amounts of money that are alluded to would be best for their treatment journey. Thank you for the opportunity to testify.
Thank you. Hawaii Association of Health Plans in opposition.
Good afternoon, Chair, Vice Chair, members of the committee. Rachel Wilkinson on behalf of the Hawaii Association of Health Plans, and we're going to stand on our written testimony in opposition.
Thank you. Joseph DeVasto, individual in support on Zoom. Joseph?
Good afternoon, Chair, Vice Chair, members of the committee. My name is Joseph DeVasto. I am a licensed mental health counselor, an addiction specialist, and a current doctoral candidate at Chaminade University in Honolulu. Thank you for the opportunity to provide testimony in strong support of SB 2425 HD1. I speak today not only as a clinician, but as someone who sits face to face with the consequences of our system every single day. Just yesterday, I received a call from a young woman seeking a referral to treatment. She had achieved 6 months of sobriety, 6 hard-earned months. She was also experiencing active suicidal ideation and urgently seeking residential treatment for substance use disorder after a significant relapse. She was ready, willing, and motivated, and yet she could not access care. Not because treatment was unavailable, and not because she lacked insight, but because of these insurance barriers. The out-of-pocket costs required for admission in Hawaii were simply too high. She was told her only viable option was to leave the islands and attend treatment on the mainland. But she is a student, she works, her support system is here. Asking her to leave was not clinically appropriate. It is also destabilizing. This is not an isolated case. I have seen this as a pattern in my 15 years of addiction treatment in Hawaii. Too often, individuals are forced into unhealthy decisions, stay close to home or forgo treatment, or leave everything behind just to access care. At its core, this is a failure. Insurance and financial systems are designed to remove barriers and are instead creating them. And the impact is not limited to one demographic. I see this affecting the working and middle class across our islands. These are our nurses, teachers, first responders, construction workers, young professionals who contribute to our communities every day. These are individuals who want treatment, who are asking for help and are being turned away, not by clinicians, but our current system. What happens next is predictable and preventable. Without access to timely, appropriate care, we see increased risk of.
2 minutes. Can you wrap up your comments, please? Thank you.
Thank you. Ultimately, I want to say care has been delayed and not denied. In behavioral health, denial of care can be fatal. Insurance should be used to remove barriers and not create them. Thank you.
Thank you. Anyone else in person or on Zoom who'd like to testify on SB 2425? Seeing none, members, any questions?
Question for HMSA. So I guess I'm trying to understand the term reimbursement. So in I think one of the testimonies cited the case where somebody, or maybe somebody gets a really large check, it's a reimbursement. But is it because they paid for the service out of pocket and now they're being reimbursed? Or did the treatment facility provide the care and then you're giving the payment to the patient, and then the patient's supposed to reimburse the patient's then supposed to reimburse the care facility.
So thank you for the question, Rep. And I think what, at the heart of this, the reason why the reimbursement goes to the patient is because the provider that they're seeing is what's considered non-par or non-participating. If a patient opts to see a participating provider, which the majority, over I believe 90% of the SUD facilities in the island or state are participating, there's a set copay and the reimbursement, or what we reimburse, goes directly to the provider. In the case of a non-par, non-participating provider, whether it's SUDs or any other type of medical care, because we don't have a contract with them, we have a contract with the member. So the member would pay upfront and then we would reimburse them. So that's why this whole issue about non-par and par, that's why the amount of monies is going to the member directly. But in this case, starting this Friday, we'll be paying, at least for SUDs, the non-par facilities directly. But it's a function of the provider choosing to not be a part of the participating network.
Right, but it's so, okay, thank you for also confirming or affirming that it is possible that what this bill is trying to do.
There's a large reason for having those contracts and agreements with the providers and having them to be participating. It ensures quality of care. It also controls the cost of out-of-pocket for the member. In non-par settings, there's what's called balanced billing, where we would, in a participating setting, we would set the amount of the copay and the reimbursement, and that's it. In non-par settings, they can charge whatever they want and go back to the member for that balance. So that balanced billing is something that we feel very strongly about. It's not a copay.
Thank you.
Why wouldn't HMSA honor an agreement by its member to assign its benefits or assign the payment to a non-par facility? This bill seeks to force HMSA and others to honor that kind of agreement. So if I'm the patient and I tell HMSA like, hey, I'm going to this other facility, I want to assign my benefits instead of you paying directly to me. It's voluntary by your member. So why wouldn't HMSA honor that agreement? I know you're not a party to it, but it is kind of like creating a third-party beneficiary kind of situation.
The assignment of benefit takes the member out of the decision. So in the case of a non-par provider, I seek them by choice. I would still have to submit the reimbursement and take on the potential, I guess, burden, if you will, to seek that care. But if the assignment of benefit is granted or honored, that provider can charge whatever they want and potentially even balance bill the member after the fact, because now they're in possession of it. So that's why there are other reasons why we would hope that providers would become participating in our network, largely in part due to the quality of care and the control of cost of the member.
So it's fraud that you're worried about, is that the?
We are worried about fraud. I mean, we've seen across the country, I mean, this space is just wrought with it. I mean, in 2025, the DOJ found a $650 million scheme, almost a mill of patients, if you will, especially around Native American reservations and homeless, where they would sign people up for plans and basically just bill tons of reimbursements against the Medicaid system in Arizona.
Has that been happening here?
We're seeing fraud in the state, but we're not quite at that level, largely I think in part because there is no assignment of benefit.
So have patients tried to do an assignment of benefits with you folks before and you've denied it, or what's?
I believe our contracts have an anti-assignment of benefit clause. I can't speak directly to it.
Okay. Now you said you're changing your policy some for the SUDs. When is that going to take effect?
Friday the 27th. So in practice, it took a little bit of time to make the system work, but starting the 27th, those should be lined up to allow for direct payments for SUDs.
So 3 days from now?
Yeah.
Is that not essentially the same thing? I mean, how will fraud be addressed if you start this new policy?
Because the member is still in the position to have to file the reimbursement, of which the reimbursement would go to the provider. In the case of assignment of benefit, that's all out of the hands of the member. And I think that's the biggest difference of what we're looking at.
Okay, so the patient will still have to take some steps to request the money from you folks, but instead of the money going back to them,
it would go to the provider. But we feel that allows them to make a decision about their treatment plan as well as the potential cost of seeing a non-par provider.
Thank you. Thank you.
Any other questions? Seeing none, moving on to SB 3045 SD1 HD1 relating to health insurance. Requires all health insurers, mutual benefit societies, and health maintenance organizations in the state, including Medicaid managed care programs, to cover the cost of continuous glucose monitors and related supplies under certain conditions. DCCA Insurance Division with comments.
Good afternoon. Justin Tue for the Insurance Division. We stand on a written testimony providing comments.
Thank you. Department of Human Services with comments on Zoom. Oh, in person.
Aloha Chair, Vice Chair, members of the committee, Meredith Nichols on behalf of DHS. And we'll stand on our testimony. However, I do want to note that we left off the HD1 in the title of our testimony and also did not recognize the good work of HHS and the Health Committee in the last hearing where the section that we had requested be removed did get removed from the current status of the bill. So we wanted to acknowledge that. And yeah, we're here for questions if you have any. Mahalo.
Thank you. State Health Planning and Development Agency in support.
Hi, Chair, Vice Chair, members. Jack Lewin, SHPTA. I just wanted to state that on behalf of a woman named Gail Ogawa, who is the secretary in our agency, who was denied a continuous glucose monitor twice, and then she passed from hypoglycemia. That shouldn't happen again. So I think, and I'm hearing some reasonable, in the fourth year around, I'm hearing from insurers that they're taking a more reasonable approach to this. But we think that when you have an insulin-dependent diabetic person and their physician has ordered a continuous glucose monitor, it's standard of care. So that would just be one simple tightening up of this that we'd like to see happen, and not to have us come back next year to talk about it again. Thank you.
Hilo Benioff Medical Center Foundation in support on Zoom.
Aloha, Chair, Vice Chair, and members of the committee. I also want to thank Meredith from MedQuest and Jacqueline from SHPTA for providing support for this bill. I'll stand on my testimony, but we did a series of community gatherings, and what we found is insurance has been inconsistent with supporting our patients and community members with access to glucose monitors. And we are the only state in the nation that does not have a published criteria. And so, as Dr. Lewin said, it is a standard of care, and we would like to see this get passed out of your committee to protect folks. Happy to answer any questions.
Thank you. Hawaii Association of Health Plans offering comments.
Good afternoon again, chairs and members of the committee. Rachel Wilkinson on behalf of the Hawaii Association of Health Plans, and we're going to stand on our written testimony providing comments.
Thank you. Anyone else in person or on Zoom who'd like to testify on this measure? Oh, sorry about that. I skipped you. CCCA Insurance Division.
You got a tiger job?
Oh, sorry.
HMSA,
Wait, where am I?
HMSA, go ahead,
HMSA,
Walden.
sorry.
Okay, I
you're
don't think
not.
Justin will be offended. Chair Matayoshi, Vice Chair Grant, and any members of the committee, Walden on behalf of HMSA. We stand on our written testimony offering comments. I just would like to note that in 2025, we've updated our coverage policies internally to basically allow for anyone on a type 1 or insulin-dependent diabetes journey to get access to a CGM. We do have some concerns that broadening it to gestational as well as type 2 mandated could impact the supply chain of it. We feel that medical necessity is a huge component of issuing of the CGMs. And we just like to highlight in the Auditor's Report 2606, which dealt with the mandate of CGMs. They ended by concluding that House Bill 820, which was the bill at the time, which reiterates coverage for continuous glucose monitors when medically necessary and prescribed, would not alter existing insurance coverage requirements in the Hawaii law. Thank you for the opportunity to testify.
Thank you, HMSA, sorry about that. Okay, anyone else who'd like to testify on this measure? Seeing none, members, any questions?
questions for HMA, but I'll just add another letter, HMSA. So the bill already requires medical necessity in a prescription. Some other testimony though, I think maybe including yours, said that if it's already, these glucose monitors are covered already if they're medically necessary and prescribed.
Right.
So are you already doing what's in this bill, or have you already been doing what's in this bill?
Yes, we do provide for medically necessary CGMs. That's how we answered the.
But that's like type 1 diabetes only, you said?
I mean, there's a varying, I guess, plethora of different factors that goes into the medical necessity, but I believe that regardless, we found that type 1 or insulin dependency is a pretty key indicator of medical necessity.
So if someone had type 2 diabetes and their doctor decided that it was medically necessary and provided a prescription for it, would HMSA cover it?
I believe so if the medical necessity criteria was met.
Okay, and that's, so you're relying on that doctor to make that call, or are you guys second guessing some of those?
That I can't speak to directly, but I believe that, I mean, again, in our coverage would be for all medically necessary requirements of CGMs. But the type 1 or insulin stands out because of the acute need, I think, for constant monitoring and up-to-date readings of blood sugar.
No, that's fair. I mean, but we don't want type 2 to become type 1 too, right? I mean, to me, this bill is a little more preventative. I guess what I'm trying to get to is why this bill, why the introducer of this bill felt it was necessary to even put it up. If doctors, unless doctors who are determining that a glucose monitor is medically necessary and are prescribing them are getting denied, that's the only situation I can think of right now.
I think
where
there's a couple issues, Chair. I mean, this bill has been introduced, I think, a handful of times, right, about 4 or 5 years. Our policy has changed in 2025, so recently. I know that there's been a big demand for CGMs outside of the diabetes space, largely in the lifestyle space. So I mean, there are talks of access to this, but in terms of diabetes, the medical necessity component will continue to be kind of the driving force as to HMSA coverage for it.
Yeah, and this bill is just for diabetes, including gestational diabetes, so.
Type 1, type 2, and gestation. The type 1 that we respect is acutely needed, and that's why our internal policies cover for some. But in terms, I can't speak necessarily to the type 2 or gestation. But in the policy, it does outline that insulin dependency is typically an indicator of medical necessity.
Yeah, but you're not aware of any denials for type 2 or gestational diabetes where the doctor has determined medical necessity and
that I'm not
prescribed? Okay. But you think that it would be covered? Because if so, then should you guys be okay with this bill? Because it's.
I mean, we still have, because there is, and maybe it's gotten better, but there were concerns about supply chain issues in the last couple of years. But I mean, it still is an issue that if someone acutely needs it, that there could be impacts on the supply chain because now everyone has access to it. There is a little bit of a concern. We don't mean to paint a doom and gloom picture, but it is something, a reason why the medical necessity and I think standard is.
Okay, thanks. Sorry, well then I had one other question based on your testimony. Testimony referred to outpatients being covered. I just want to make sure that, because my understanding of these monitors when talking to people is that these monitors are not just for outpatients, they're used for people experiencing diabetes just day to day kind of thing. Did your testimony mean that HMSA had been covering it in the past for just people in outpatient procedures and settings, or did you mean for everyone, not just outpatients? And maybe I'm misinterpreting the word outpatient to mean.
means somebody in the hospital.
Yes.
Is that for all?
So this is a durable medical equipment, so someone would have it with them constantly or constantly on them outside of the hospital.
So it could be my misunderstanding of it, but is an outpatient anyone outside of the hospital, period? So there's no time limit to how long someone can be considered an outpatient?
I mean, I believe that if you have the type 1 insulin dependent diabetes, it's kind of a lifetime
outpatient,
so you will have access to this throughout the duration.
No, thanks.
Type 2, I believe, can be reversed, but type 1, I don't believe it can be reversed.
Okay, thanks. adopted.
Any other questions? Seeing none, moving on to SB 2761, SD2, HD1 relating to social media. Requires a social media platform to take reasonable steps to verify the age of new and existing account holders on the social media platform. Prohibits a platform from allowing individuals under 16 years of age from creating or maintaining an account or profile absent express consent from a parent or legal guardian. First up is DCCA's Office of Consumer Protection with comments.
Good morning, good afternoon, chairs, vice chairs, members of the committee. I'm Raji Tolentino with Office of Consumer Protection, and we will stand on our testimony offering comments. I'm happy to answer any questions.
Thank you. Net Choice in opposition on Zoom.
Yes, good afternoon, members of the committee. My name is Amy Boss, Vice President of Government Affairs at NetChoice, a trade association dedicated to free expression, free enterprise online. We share the goal of protecting kids online, but we do have serious concerns with this bill as written. The age verification requirements do create a massive privacy problem. To verify someone's age, platforms would need to collect sensitive documents, government IDs, biometric data from every single user, including adults. That data creates a honeypot for hackers and puts Hawaiians' data at risk. So while the bill is framed as a protection for children, it functionally creates a digital ID requirement for the entire internet using public. Second, we do want to raise some of the constitutional issues. Courts have consistently struck down similar laws in other states for restricting minors' access to constitutionally protected speech. Most recently, courts have struck down nearly identical laws in Arkansas, Louisiana, Ohio, Georgia, and California for these reasons. We'd love to work with the committee on targeted solutions like digital literacy, education, ways to protect kids online without putting individuals' data at risk. So happy to answer any questions committee members may have, and thank you again for the opportunity to testify today.
Thank you. Computer and Communications Industry Association in opposition on Zoom.
Good afternoon, Chair Yoshi and members of the committee. My name is Megan Stokes, and I'm the State Policy Director at the Computer and Communications Industry Association. We stand on our written opposition, but would like to reiterate that Senate Bill 2761 involves core First Amendment protections. Courts have consistently held that the government cannot broadly restrict lawful speech in the name of protecting minors, particularly where doing so would limit the access for adults and older teens. This bill's approach, especially its age verification and parental consent requirements, risk doing exactly that. And similar laws across the country are already being enjoined on those grounds. Again, thank you for the opportunity to testify.
Thank you. Meta in opposition.
Good afternoon, Chair Matayoshi, Vice Chair Grandinetti, members. Thank you for the opportunity to testify on behalf of Meta. Meta opposes this bill. We certainly share the goal of online protection of children, teens, but we have to oppose this bill. Chair Martin in HHS took the bill in, we think, a positive direction by getting rid of the ban for under 16 and substituting parental control. But the way it's written, it creates many problems. And I'll just highlight two. One, it's unworkable for families, and it's going to create a lot of confusion because it's going to be on an app by app basis, meaning every app has to set up some kind of age verification and parental consent. That, as one of the other people testified, creates a gigantic amount of data privacy problems. But for families, if teens use maybe 40 apps a week, if you have to keep doing this over and over again, it's going to be burdensome on families of people in Hawaii. And then the data privacy issues, we recently had a data privacy breach up at the UH in the Cancer Center. We don't want to create another treasure trove of things that people can get to. Meta suggests that the way to go is to have an app store statute. We appended one to my testimony, and that's a model bill. It's been passed, a version of it has been passed in 4 different states, Texas, Louisiana, Utah, and Alabama. And that way you already have this data, which goes in at the App Store level or the operational. When somebody gets an iPhone or something like that, they have to put in key data, and then they just send a signal out to all providers that says this teen is at a certain age. And so we think that is a much more workable solution rather than creating a problem. So we'd ask you to consider that. Perhaps, people don't like to gut and replace, but you could use those provisions and put them into this bill. And finally, Meta does share all these concerns. Meta tries to keep teens safe with teen accounts where parents can restrict the amount of time that kids can be on there, and establishes that there's PG-13 content in the event that somebody is under the age. So thank you very much for the opportunity to testify. I'll be happy to answer any questions.
Thank you. Anyone else in person or on Zoom would like to testify on this measure? Seeing none, members, any questions?
Yeah, David, I've got a question for you.
Certainly.
So you suggested the App Store kind of age verification on that level, which I'm not opposed to. I actually think that's a pretty good layer to add. My understanding, though, is that Utah tried to implement that, and they're currently being sued, possibly by you guys, for that idea. So I just want to make sure that if you're proposing that idea, you're not going to sue us for putting in your idea.
Well, I certainly have no intent of suing you for putting in one of my ideas, but my understanding is that Utah was sued on something else, but I don't have a perfect understanding of that.
Suits. But yeah, could you look into that?
And let me look at that and communicate with your office, Chair. I apologize, I'm not up on that.
No problem. Thank you.
Thank you.
Appreciate it.
I have a question for Office of Consumer Protection. OCP. I was just wondering if you could speak to some of the data privacy concerns, because I guess I was a little surprised to see them not addressed in your testimony, because we had just recently heard SB 3016, which kind of related to personal identification.
Well, as I mentioned in my previous testimonies, there are 19 states have a comprehensive data privacy law. So you have a framework where the laws they regulate how you collect data, protect data, sell data. We don't have that. Even the definition of personal information in Chapter 487N, which our office enforces, is outdated. And I think Senate Bill 3016 is trying to expand the definition of personal information. So what we really need is to have a framework for protecting data, not having these patchworks of legislation to have a definition of data minimization in one bill and in another one. It makes it hard for us to enforce. It makes it hard for business to follow the law as well.
Thank you. Any other questions? Okay, seeing none, moving on to the final measure. Final? No, not quite. SB 3001, SB 2, HD1 relating to artificial intelligence. Requires operators of conversational artificial intelligence services in the state to issue certain disclosures to account holders and users. Requires operators to develop protocols to prevent the production of suicidal ideation in account holders. Establishes protections for account holders and users of conversational artificial intelligence services, and establishes protections for minor account holders and users of those services. First up is the Department of Education and Support. Not present. Office of Consumer Protection with comments.
Raji Tolentino again with Office of Consumer Protection. We offer comments on this bill. We suggest deleting the definition of sensitive data because that term is not actually used anywhere else in the bill. We also noticed that the personal data is defined, but it does not appear elsewhere either. At the same time, the bill does use the term personal information in the annual reporting requirement, so we do think it would be helpful to define that term As we mentioned earlier, Chapter 487N already includes a definition of personal information for consumer privacy purposes. If the definition of personal information is expanded in this session in Senate Bill 3016, then this bill should be amended to mean personal information is defined as in HRS 487N-1. On the enforcement side, because OCP already has authority to enforce Chapter 481B, we recommend clarifying that OCP may also enforce this bill. We think this would help avoid confusion and make the enforcement provisions clearer. And finally, we request a general fund appropriation to support enforcement by our office. Thank you.
Thank you. SHPTA offering support.
Chair, Vice Chair, members, yes, we do support this bill strongly. And we've got some comments coming into SHPTA that suggest maybe our testimony didn't reach quite as far as it might have. And some of these came from actually young users, but as we're in the section later, so I didn't include this in the testimony, but I will verbally just share what we've received. Under ensuring the operators can avoid protections by ignoring age signals, right around that topic. We're using a standard in this bill of knows or has reasonable certainty. And that certainty piece is could be, I think, improved upon by having a standard that said should reasonably know in the course of business as the standard. Where it would be a little bit, if a program did not really ask the age, but knew that there were minors using it on a frequent basis, that understanding would be a little bit more acceptable. So I can send that to you if you'd like. Right, thank you.
Thank you. Office of Wellness and Resilience in support.
Aloha Chair, Vice Chair, members of the committee, Naomi Leipu with the Office of Wellness and Resilience. We stand in our testimony and support. Thank you for hearing this measure.
Transparency Coalition in support on Zoom.
Thank you, Chair, and members of the committee. My name is Jay Jessima. I'm testifying in support of SB 2001 with amendments. I'm a co-founder of a nonprofit called the Transparency Coalition based in Seattle, and it was my pleasure to testify in front of you for Rep. La Chica's House Bill 1782 a few weeks ago. We've been working with lawmakers in multiple states. At this point, we're actually working with lawmakers in about 20 states on bills. And I'm pleased to report today that Washington's governor signed a thoughtfully crafted bill just today that includes several provisions that are absent in SB 3001, and I wanted to highlight a few of them. One is that the definition of conversational AI exempts applications that are integrated into another web application. By this standard, a very commonly used chatbot like Google Gemini or Meta AI, among others, would be exempt. And I'm sure that's not the intent of the author or this committee. Both have been implicated in well-publicized cases of harmful effects of chatbots. The second is that all the chatbots laws that have been enacted so far, and at least one that will soon be enacted, all provide for a private right of action for citizens to obtain redress when affected by chatbots in a material fashion. Why should Hawaii's residents receive less protection than these other states? By the way, TEC was neutral on the inclusion of a PRA in Washington and Oregon, where I had firsthand knowledge of the negotiations. And then I think the last thing I wanted to touch on was that the chatbot laws in Washington and Oregon include prohibitions on manipulative engagement design. These have been implicated in many cases of emotional and physical harm among children. And these provisions are absent in SB 3001, but present in House Bill 1782 as an example. Thank you for hearing this bill, and we hope to work with you and the committee on appropriately amending this piece of legislation. I'm available to answer any questions.
Thank you. Young People's Alliance in opposition on Zoom.
Aloha, Chair Mariyoshi, Vice Chair Grandinetti, and members of the committee. My name is Mick Tobin. I am 23 years old and the co-founder of the Young People's Alliance, a youth-led bipartisan organization representing 2,400 students across 72 campuses nationally. I strongly support protections against AI companions. 3 weeks ago, I testified in support of an AI companion safety bill, HB 1782, to this committee, actually. And then 2 weeks ago, I flew to Honolulu to testify in support of the same bill to the JHH committee. With that said, I strongly oppose SB 3001 unless amendments are made. As is, the bill contains significant gaps that undermine its ability to meaningfully protect Hawaii's keiki and families in favor of protecting big tech. Key human-like design techniques that foster emotional dependency and romantic relationships in minors' everyday use of these tools aren't limited in this bill, allowing chatbots to create emotional bonds, manipulate engagement, and claim sentience. And those provisions protecting against these type of engagement tactics were included in the Washington bill that Jay just spoke of and are included in HB 1782. The definition of conversational artificial intelligence in this bill excludes AI chatbots that exist within social media platforms such as Snapchat's My AI or Instagram's Meta AI. These are features targeted for minors and marketed as replacements for friends. They remember conversations across sessions, and children treat it like a friend. Why should they have special privileges? Moreover, the bill's knowledge standard allows operators to avoid obligations by claiming ignorance of whether users are minors. Its enforcement framework places the entire burden on the Attorney General's office while leaving harmed families with no direct path to accountability. Bills in 6 states, including SB 3001, have appeared with many of these same gaps, suggesting they were coordinated in some form, and more personally just worried that big tech is sliding this language into otherwise strong bills without legislators fully knowing. I've included stronger language alternatives at the bottom of my testimony, drawing from Hawaii's HB 1782, which has passed the House and is currently moving through the Senate. If we pass SB 3001 without amendments, we'll cement a national status quo where legislators feel like they've addressed the problem, but children still aren't protected. We must stand for Hawaii's keiki and families, not for big tech. Please amend SB 3001. Mahalo.
Thank you. Next up is Google in support.
Aloha Chair, Vice Chair, members of the committee. Nahalani Parsons on behalf of Google in support of SB 3001. We recognize that there is currently no statute in the HRS that regulates chatbots or conversational AI and the protection for minors. And so I appreciate the committee's attention on this matter. This measure would set an industry standard that is in alignment with other states such as California, New York, Washington, and Oregon recently. We respectfully ask that the committee, as they move this conversation forward, to keep the bill focused narrow to address the intent to protect our keiki, and that we can use this measure to give the Attorney General a tool in the toolbox that they don't currently have. So appreciate the opportunity to testify and available if you have questions.
Thank you. Brianna Harmon, individual offering comments on Zoom. Not present. Okay. Anyone else in person or on Zoom who'd like to testify on this measure? Seeing none, members, any questions?
Actually, I do have one for Google. No. There is an exemption in here for integrated chatbot services. Gemini was brought up, which is you guys. Why was that exemption put in? What's the justification for that?
My understanding is they're not exempt. The Gemini currently adheres to all of the requirements in this bill in their own applications. So as the bill is currently written, they already do administer those protections. They already have the protections against suicidal ideation and protections for minors. So the bill wouldn't add anything new that they're not already currently doing. So my understanding is it would apply.
Chair, may I comment?
No, unfortunately. Hold on one second.
Sure. I have the bill in front of the chair if you want to.
Yeah, I think it's, oh wait, subsection H. So on page 7, there's a carve out for conversational artificial intelligence service. And that's what the other testifiers are complaining about, saying that that would exempt certain things like the integrated chatbot AI, maybe Gemini, other things from that. So in your perspective, that does not exclude Gemini?
Without being an expert on this matter, I would have to defer to them and check. But my understanding of this is things like when you defer to the web interface for the airlines that have the inbuilt chatbot service, and then they help you troubleshoot your change of flight or things like that. That would be considered that. But Gemini itself is.
So you folks wouldn't have any issue with taking out that section then?
Moving, I would have to double check about removing the language, but as far as I know, that they don't have any issues with it.
Do you know why that? So you're saying that section got put in more for like the Hawaiian Airlines chatbot?
That was my understanding about what it would apply to, like those types of like user interfaces that are service orientated.
Okay, thank you. Let's hear from the other testifier. Did you have something to add?
No, I think maybe we can add clarification language that says so long as it doesn't behave like a conversational chat, but that way there might be ways to clarify it so it only limits it to customer service chatbots like the Google testifier suggested. So there may be a suggestion we can make there.
Okay, that's fair.
Because I think Meta AI also has the same thing. It's integrated into a web application, Facebook. So it might also be exempt in our reading of the bill. And this is very similar language in some other states as well that we've been pointing out.
That you've been fighting against.
Yes.
Right? Okay.
Yes, that's right.
Okay, thank you. Members, any other questions?
I have a question,
Sure.
for Google, for now. I was wondering if you could speak to the, private right of action.
Sure. My understanding of I was just sharing with someone recently, I know Washington and Oregon included the language. We personally are not getting involved in that language, but my understanding why Washington and Oregon included that was more of a budgetary issue because their state budgets were in a deficit and any bills that were at that point that could move forward couldn't have a finance referral on it. So they added the private right of action at the last minute in order to keep the bill going. So it wasn't actually to do with the private right of action, it was to do with more getting the bill moved forward in a year that they couldn't, all the bills died when they had or finance committee on it.
To like remove some of the enforcement pressure from.
Yeah, they were struggling with that internal. So that's my understanding, but I don't have a position on the private right of action.
Thank you.
Vice Chair, may I correct the record there, if it's possible?
He was involved in the thing. Go ahead.
Yeah, I was involved in both bills. Both bills emerged from the drafting table with the private right of action. So it's not accurate to say that it was removed, it was added in at the last minute or introduced as a compromise. Both bills had that from the beginning, and Tech was neutral. I mean, I can send you a picture of the people from Tech smiling next to the governor today when the bill was
just because it came out of drafting though, that doesn't necessarily mean that it wasn't put in for budgetary concerns though, right?
That is entirely true. Yeah, it's entirely possible that the budgetary constraints played a role, but both Washington and Oregon provide the AG the option of enforcing it and also offer a private right of action, which is another formula you could, consider for the state of Hawaii.
Okay, thank you. Any other questions, members? Okay, recess. All right, we're reconvening for decision making. First up on the agenda is SB 2433 SD1 relating to condominiums. Chair's recommendation is on page 7 to delete subsection F. Page 5, line 21, we're gonna add a subsection 6 to the list, adding subsection 6 to the list of, for uses for the funds collected by the Real Estate Commission and to redefect the date. Members, any comments?
I'm sorry, I don't have it in front of me. Do you mind just one sentence on what those two sections that you're?
You can pull them up. I didn't write it down.
Oh,
So
sorry.
the second
Okay,
one is adding what we're trying to do to the list of things the funds can be used for. Otherwise, they'd have kind of trouble using it. Subsection F, I believe.
I'm here, I'm at
You can
subsection
leave
F,
it.
but what are you doing with that? Deleting
We're
that?
deleting it, yeah.
Oh, that's the most important part.
I believe it's unnecessary. I think it's repetitive.
Okay. Thank you. I'll be voting, given that I think this is the, I'll vote with reservations on that.
Okay.
Yeah, I have to, okay.
Yeah, the Real Estate Commission already has the powers to do this. That's why we're taking it out, so it's not confusing. Okay, members, any comments? Okay, Vice Chair for the vote.
Voting on SB 2433 SD1, Chair's recommendation is to pass with amendments. Chair and Vice Chair vote aye. Representative Chen.
Aye.
Representative Iligan.
Aye.
Representative Ichiyama. Aye. Representative Iwamoto.
Reservations?
Representative Kong.
Aye.
Representative Lowen.
Aye.
Representative Martin.
Aye.
Representative Tam.
Aye.
Representative Perry.
Aye.
Chair, your recommendation is adopted.
Okay, thank you, members. Moving on to SB 2047 SD2 HD1 relating to pharmacy benefit managers. Chair's recommendation is to adopt Kaiser's proposed amendment, which is just a section change to redefect the date. And I do want to include in the committee report the funding request by the insurance commissioner, which is pretty heavy. Members, any comments? Okay, Vice Chair for the vote.
Voting on SB 2047 SD2 HD1, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to SB 2425 SD2 HD1 relating to health insurance. Yeah, after some consideration, given that HMSA is already implementing a very similar program to this starting Friday, Chair's recommendation is to defer this measure at this time. I do want to note that I'm a little disappointed that it had to come to this to get movement on this issue, but I am grateful that HMSA is acting at this time. So we'll be deferring this measure. Moving on to SB 3045 SD1 HD1 relating to health insurance. We have some technical amendments to make, and I'd also like to redefect the date. Members, any comments? Okay, Vice Chair for the vote.
Voting on SB 3045 SD1 HD1, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to SB 2761 SD2 HD1 relating to social media. We'll be deferring decision-making on this matter to tomorrow's agenda, 2 p.m. agenda in this room, 329. Last up on the, well, not last up. Next up is SB 3001 SD2 HD1 relating to artificial intelligence. I've got a number of amendments we're going to be making here. Chair's recommendation is to first define personal information as the same as under HRS 487N-1. On page 9, we'll be deleting the term sensitive data as it no longer appears anywhere in the bill, just kind of left over. On page 8, we're going to be also deleting the term personal data as it also no longer appears in the bill, except for in the definition of sensitive data, which we're already deleting. Subsection H on page 5, we're going to add language notwithstanding the UDAP section or any law to the contrary, or subsection J, just for clarity. We'll be adding OCP as an enforcer on page 5, line 7 for clarity, along with the AG. Adding language from HB 1782 under the protections for minors section. We'll be adding that to the bill. which restricts the chatbots from doing certain things like creating emotional dependency and such. Deleting the conversational artificial intelligence service carve-out from page 7 and redefecting the date. Members, any comments? Okay, Vice Chair for the vote.
Voting on SB 3001, SD2, HD1, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to SB 2852, SD1, relating to civil rights. We'll be redefecting the date. I also want to revise the bill so that rather than establishing the accessibility requirements in statute, we're going to require the Hawaii Civil Rights Commission to adopt rules to establish and implement the accessibility requirements instead. Members, any comments? Okay, Vice Chair for the vote.
Voting on SB 2852, SD1, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving the true last one on the agenda today, SB 2471, SD2, relating to the powers of artificial persons. Hope we don't get too smoked in court. One of the major problems that I wanted to at least fix in this bill going forward, on page 13, line 12, and page 15, lines 4 through 5, we're going to be deleting the language charitable or public benefit language. Adding this language would put many existing nonprofits that do not fall into that category in jeopardy of in jeopardy of losing their nonprofit status, which would include unions and veterans organizations, among others. So not the intention of the bill, and would be extremely harmful were that language to remain in. I do want to note in the committee report the concerns brought up by the AGs about Citizens United and other constitutional concerns that this bill may face. I also want to note in the committee report that it is this committee's belief that natural person's free speech is not impeded by the restriction of corporate speech, and the natural person is still able to exercise their free speech however a natural person would, aside from within that corporation. I'm also going to be redefecting the date. Members, any comments? Yeah, Rep. Iwamoto.
Thank you, Chair. I just wanted to express my disappointment that the Attorney General's office actually weighed in on this when they may be in a situation that we may require them to defend us. On other bills where they clearly, they position themselves in a stronger position to defend our bills by not participating and providing testimony on other bills. And so I felt it was really not, anyway, I was disappointed by that decision they made. But thank you for your amendments. I think it does make sense to remove the nonprofits because they're not allowed to make political contributions anymore. Thank you.
Any other comments? Okay, Vice Chair for the vote.
Voting on SB 2471, SD2, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members. We're adjourned.